Hello, and welcome to the Journey of Grief, Becoming Us Without Them. Today, I've invited some panelists to talk with us about addiction. And my goal is to look at all the forms of grief, and the addiction and recovery process is nothing but grief. And these are some folks who have worked in the addiction field a long, long time and seen a lot of people handle or not handle grief as it relates to addiction and recovery and long-term sobriety. So this is going to be a great conversation. So I would like to invite each one of you to introduce yourself and tell us a little bit about your work. And how about if we start with Azzie?
How you doing? My name is Azzie Thomas. I am a AOD, alcohol and drug counselor, caseworker, social worker. I work with I work with the homeless. It's called PSH, Permanent Supportive Housing, where we support the homeless in the housing with case management, provide wraparound services, doctor's appointment, transportation to doctor's appointment. You name it, the whole nine, we do it. Me, myself, coming from that background as well. Been doing this for quite some time now, about 15 years, maybe even better. And it's just, to me, it's a blessing to help others that's in need, if they want it. Thank you.
Thank you. Okay, how about Steve? Would you like to introduce us to you and your work?
Steve Carver. I'm a LAADC, LAADC, and as a licensed advanced alcohol drug counselor. I have been in the field for going on 23 years. I haven't worked for a whole bunch of people, which is different. A lot of people work for all kinds. I've only worked for 4. And so I am retired from Kaiser. I presently work at Diamond House Detox, IOP and residential, part-time. It's my fun job. I love it there. They're a great bunch. And yes, we have seen a lot of things over the years. And I think that this topic, and I got excited when you asked me to do this, so that's why I'm here.
All righty. And Mary, how about you?
Hi, everybody. I'm glad to be here with Azzie and Steve and Barbara. I'm Mary Kennedy. You're seeing me here in my office in San Francisco, where I live and work. I've been here for many decades, and I am a licensed clinical social worker. You might see my initials in the screen. I've done a lot of things in that profession that I believe is a calling and a vocation, which is what excites me about this particular topic and talking with like-minded people about addiction and recovery, its intersection with grief and loss. Right now, my work includes having a private practice, like a traditional psychotherapy practice. I work with adults, I work with teenagers, I work with parents, couples, families, adult children. I like to say anybody who's been impacted by their own or somebody else's substance use or process disorder, compulsive behaviors, as well as those that identify as addicted or those who don't yet identify as addicted. I also founded and direct the Addictions Institute San Francisco. We are a teaching and training institute for professionals in the field who want to deepen what they're doing, have a community of colleagues, as well as I host a team of therapists who receives referrals for those who are looking to work with a therapist. I am also a person that has many relationships, I think like we all do. I am a mom, I'm a wife, I'm a daughter, I'm a sister, I'm a cousin, I'm a good friend, and I have experiences up and down the years with my own loss, which really informs me in the work that I do to support and bring compassion and care to people that I work with and we work with in the field.
Great. That's awesome. So it's so great to have you all here. You represent years of experience and all of the experiences that are involved in addiction and recovery. And so you've kind of seen it all and done it all. So it's pretty great to have you all here together. And so I asked each one of you to suggest a topic for us to talk about. And so I'd like to start with Mary, and what you wanted us to talk about was the importance of grief and loss in active addiction and recovery, understanding of grief as expected in this process, and its relationship to letting go of control as recovery deepens. And definitely letting go of control is the biggest thing from beginning to end, actually from birth to death, but in recovery in particular. So get us started with that, Mary.
Sure. Thanks, Barbara. That's great. I'm impressed that you remember my whole bit that I wanted to speak about, but surely I'm happy to go in different avenues as we need to, of course. So I believe, and I think most of us believe who have been touched ourselves by addiction or ourselves by recovery or our loved ones, I believe that addiction is actually a chronic experience of grief and loss. And by chronic, I mean long lasting over time, not acute or once and then once here, long lasting. It is a series with numerous examples of loss. And in active addiction, which is when you yourself or someone you love is using, or in a difficult, painful process of compulsive behaviors like gambling, sex, work, shopping, spending, betting, we know, I think, in the field that it is a persistent loss of, and we can fill in the blank, loss of friends, loss of loved ones, loss of money, loss of jobs, loss of one's physical health, loss of one's mental health or cognitive, or we would say the thinking capacity, loss of feelings and emotions. We know in addiction, and the way we talk about it is that we go numb. Addiction is a great neutralizer, and I might say even more than that, it numbs people, which is often a reason why people are attracted to it, because life has been painful for them already. In addition, we know that active addiction and addiction is a loss of one's connection to a spirit, or we might say the divine, something outside of oneself that's bigger than you. We lose that. We hear this all the time. I would say the four of us hear this, and then others who work in the field, about a loss of a sense of purpose in life, of where my North Star is, or my guiding light. Ultimately, I think what we do in our work, the three of us anyway, who are specialists, is we get to know people where their addiction has taken them way down the ladder, or we sometimes say down to the bottom floor, the basement, where a loss of a sense of who they are, who I am, has been so profoundly happening that a sense of who I am and my integrity, my dignity, my being a person is no longer even in my realm of understanding. I've gone beyond that.
Absolutely.
I think we all work with that, very actively. The other thing I just want to say about my topic is, so that's a short comment. I'm happy to say more as we get talking. Recovery also has a grief and loss experience to it. And I like to talk about it not as a warning or here's a yellow flag, beware. I like to talk about it as a reality, because I think historically in the field, the going narrative has been, let's talk about all the wonders of recovery. Let's talk about how terrific it is when people get sober. Let's talk about the incidences of consequences in neighborhoods, communities, cities, and states. They go way down when people find abstinence and sobriety. What doesn't get talked about until more recently, and thank goodness we have places like this to talk about it, is at the same time that stability is happening, that somebody is safer, and therefore people around them might be safer, there is also a loss process that's going on. People grieve the loss of their lover, often is talked about, the bottle, the joint, the needle, the line of cocaine. That is a loss of attachment to the drug or the substance. And I think that needs to be talked about, which is why I'm so happy to be talking about it here. It's not impossible. It's also not forever. Because as you talked about, Barbara, my description of the process of recovery is actually a process that happens over time. And that feeling of loss and the grieving feelings that happen with the loss of using, and that the coming to the clarity that I can't use again, ever. Actually, ultimately, I think people who are in recovery come to that moment of clarity, right? Wow, I've lost control wildly. I can't drink or drug again, right? There's a loss in that and a grieving process that changes over time. And people in long-term recovery will talk about still having missing, some remnants of that, missing that drug, missing that drink, missing that place in that bet on that sports game. And we'll also talk about it getting easier. And we'll also talk about getting a little bit less intense over time. So there's hope as time goes on and people deepen their recovery from addiction. So that's some of the stuff that I wanted to talk about. I think the letting go of control is also there because at the same time, people experience the grief and loss of the addicted substance or the process. They're also coming to an awareness that I have lost control and coming closer to letting go that I ever had control in the first place. I haven't. And that is a process that takes a long time. Again, very possible with people like us and other helpers in the field and good people around them who understand sobriety and recovery. So there's lots more to say, but that's an introduction to the topic I wanted to bring forward.
Cool, that's great. So, Steve, you are equally passionate about this invisible thing that nobody ever talks about in recovery. So say more about that.
So thanks. And Mary, you hit it on the head. The biggest thing is that over the years, I've always found that, in one place I worked, the first thing that they did when they walked in was the doctor had them on a low dose of Lexapro. Put them on Lexapro, and it's like, yeah, hang on a minute. We don't even know what they're feeling, yet. And the thing is that when we hear grief and loss, the only thing we ever think about is death, and it goes so far more. And the biggest thing is that, when I see people sitting in group and they're not paying attention and they're sitting there fumbling and they're falling asleep or something like that, my first thing is not, oh, they're not ready, because I hate that word anyway. It's because my thing is about willingness. I was ready when I was 13. I wasn't willing before. The thing is that, to me, I look around and I wonder what stage of grief they might be in. What stage are they going in? Because I expect clients to act out in some ways. I work with pretty, the higher end, higher bottom, we want to call it, whatever you want to call it, where their bottom is as far as it needs to go down. They just haven't had to lose everything to get there. Okay. And they're pretty high functioning, but at the same time, they're wondering, why am I feeling the way I'm feeling? You know, and sometimes it's like, you know, well, what are you feeling? Well, is this all there is? You know, well, they came in first, they're angry because one, they got their life got to this place. Okay, so there's anger. And now they're sober or clean, however you want to look at it. So they're angry. And then they're sitting there in denial, you know, going, well, you know, it gets through detox and then they get to that honeymoon stage and then they're sitting there going, well, maybe I can do this, you know, on my own. Maybe I really don't need this, you know? And I'm like, stop it. So then, you know, then they're sitting there in like the third session going, you know, maybe I'm not as bad as I was, but yes, I know I have a problem. And yes, I'm doing this. So they're bargaining, you know, and they don't even know they're doing it. Right. And then they're sitting there in about the fourth, you know, third or fourth week going, is this all there is? Is this what I got to do the rest of my damn life? These stupid meetings, these, you know, and then they go, I'm so depressed. I need meds. And we go, okay, you know, maybe you do. Well, you know, how about if you've never been diagnosed with clinical depression, why are we not looking at grief and loss first and possibly that and let them run a course before we just start throwing things at them? You know, because they're probably in a grief and loss, they're probably in post-acute withdrawal, they're probably on the wall stage of recovery. There's three things going against them, you know, and they're sitting there miserable to a point, yet they want recovery, and they're telling you, you know, I want this, but I see grief and loss going on, you know, and I talk to them about it. You know, and I tell them in my groups, when I'm doing groups a lot of times, I go, guys, you are in a, you know, I do groups at residential and I do a men's group at IOP, and I tell them, you are in a state of grief and loss. Try to figure that one out. You know, I go, how many of you have lost somebody? What did you feel like? How are you in acceptance yet for that? You know, I tell them, I said, I go to acceptance very well. My sister does not. You know, I said, I don't know how to tell you to go through grief and loss, but I can tell you that you're in one stage of grief, one or more stages of grief and loss right now, because you just lost your best friend, your security, your lover, your you know, everything about your drug of choice was everything you wanted it to do. It worked for you, and now it's gone. And it's like losing, it's like death. You know, I went through it. You know, I didn't know it because nobody told me.
Right.
But, you know, over the years, I've had really good clinical supervisors who's worked with me and they get me thinking about things. And, you know, and the grief and loss thing I've been thinking about for a long time, and I've been working at it for a long time. And this stuff is real. And but people now, they want to be drugged. And I'm like, no, you know, feel,
Yeah.
you know, because if you feel, you might get on something and you might have an understanding that to get to acceptance of, okay, yes, this is going to be who I am from now on, but it's going to be a better person, a better life, a better, you know, maybe not right at the moment, it doesn't feel it, but it's gonna. You know, and maybe you are angry and maybe you are in denial, but you can figure that out the longer you stay in treatment and the longer you're doing outside support and you get a support system, you can get all that together, but just don't give up on finding out where you're at, you know? So I really have this passion about finding where you're at in the grief and loss of of the non-active addiction of your recovery. Because if you can feel that, you can have a good, solid recovery, along with doing everything else you're supposed to do. Because it's not that hard, but it just seems hard.
Great. That's great.
where I'm at.
Okay. So Steve, you work in a place where people think they can't possibly be addicted. They can still pay cash for their recovery. And Azzie works at the far opposite end. So Azzie works where people have already
Right.
everything, all the way at the extreme end of where addiction and woundedness can take you. And
But
so
there's no difference. Absolutely no difference.
That's
the
right.
addiction process is the same. And so normalizing, helping him realize, so this is what grief is like. Maybe you're not clinically depressed. Maybe you don't need meds. Does any of this sound familiar? So as he talked to us about what does grief and loss look like in your world where you're working with people who have literally lost everything?
It's amazing. It is amazing to see the years of addiction, what it has caused, the relationships it has affected. We talking family, who you name it, friends, whoever. And then still to today, it's like it's everyone else's fault but theirs. If it wasn't for so and so, I wouldn't be here. If it wasn't for this, if it wasn't for that. But then I'm still dealing with an addiction. But don't talk about me and my addiction. Just talk about me what I'm telling you over here is about. Don't focus over here. Focus over here. Because if you get over here, then I'm not going to talk to you no more. Then I don't like you because I'm afraid that you may not like me for who I am now, for what I've done in the past. Mm-hmm. So it's also to a lot of judgment against self. I deal with a lot of people too that like with Steve, like I love what Steve was about the rehab. One thing I like doing the rehab was to learn how to say no to self. A lot of people don't know how to do that today. And it's like, if you can't put yourself on self-discipline to get somewhere better in life, then you're going to keep running into the same thing over and over. And this is what I deal with every day. I have people that's, let's say, we got them like right now, 27 to 72. Say from the 35s, I say from the 45s all the way to the 72s, some of them is no hope at all. Still in addiction, everybody fault. That's why I don't mess with nobody. That's why I'm to myself. But then also too, here comes mental health. On top of your emotional breakdown. Still self-medicate. Everybody else is wrong. Why am I right? And why can I be right with what decision that I make? What makes me wrong? No figures point. This is self-guilt. The shame that I've actually what they've been through. And it's like, here you are. You have a case manager or a social worker trying to build this relationship with you to help you. You have somebody for 8 hours a day, a job to ship, help you with your doctor's appointments, help you get there, check on your medication for you, make sure your medication is prescribed for you, make sure you're getting the right medication, make sure you're making it to your doctor's appointment. You wake up at 3, it's a food box waiting on you though. You hear me? You woke up at 3 o'clock today and all this was provided for you. What have you done for self? Nada, nothing. But yet and still, it's everyone's fault but mine. But I'm still to blame. But the thing is you pointing your own finger at self and really not giving self a chance. And I'm like, Steve say, we don't need no medication. You need to feel it. You need to feel it. For the relationships that we did, the grief and loss of the relationship that we didn't lost due to the addiction, the bad decisions from the addiction. the whole thing, you know, and then letting addiction just come in and just take over. And now, and you know, we're not realizing that addiction is giving up everything for one thing. Recovery is giving up is giving up one thing for everything. You know, and I think it's hard because, you know, one thing about when I came home from rehab, it was I had to focus on my decision making. I really want to make the right decisions. I had to. No more going back, no more backsliding. And then I had built this support team. Barbara, which was my counselor back in Salvation Army, which is still today in my life. I have another mentor by the name of Jerry, and now I got you guys. Back in my day, we would consider this a super group. Where all these minds come together and these topics just form, and we just develop just a powerful conversation through a relationship. Letting the conversation be the foundation to the relationship. And learning from each other, respecting the aspects of the life that we came from, because we all, in some form, shape, or way, deal with a grief or a loss. And it's still dealing with grief and losses today. But it's better because me, myself, I don't have no crutch to deal with grief and loss. I'm going to deal with it the best way I can, pray, give it to a higher God, control what I can, and what I can't control, I'm going to have to let go. And whether that makes somebody mad, they didn't like the decision I made, I have to be cool with that. And I have to be good with myself, because in the long run, it's about us. Even though I'm a grandfather, I'm a lover, I'm a man of God, I'm all that. But at the end of the day, I have to make sure that Azzie is all right. And that's within my relationships with whomever, wife, kids, whomever, and the outside. I have to make sure, you know, that I'm standing on point for self, and that, you know, you got a good friend, you know, and it took time to get there, and it's still taking time to get there. I'm not perfect. I was alcoholic for a certain amount of years, but today I'm Azzie, and I'm telling you, it's a blessing. And it's also awesome to hear you guys speak too, and to come to this panel with it, because this is what needs to be spoken. Because you could, I've learned so much that mental health, you just can't put nobody, take them off the street, put them in an apartment and think that you did something for them. You didn't do nothing for them. You just boxed up mental health. That's what you did, left instructions on the outside of the box. Now you left it for them to be locked up in this box and need to find instructions when they need to come out and get outside the box to find what they need. You know, and I've been dealing with, I'm on my 7th housing program, and they still can't figure it out. You hear me? They won't come to us and talk to the ones who've been in it, been in it, still in it, knee deep, neck deep in it. They don't, and we in this, like, it ain't like we know the cure, but we've been there. We know what's needed. You know, we know that mental health is at its rapid right now. You know, it's to the point where you don't know if they have addiction or they have mental health. It's that deep, and it's everywhere. You got to stop. Like, you can look left, right, to each corner is mental health. People staying in tents, you know, to give up on life. You know, here we is fighting for life, to give up. You know, somebody told me, I'd rather, he said, the word responsibility. He said, if you take ability off the word response, ability is response. He said, I no longer respond to politics, life of the world, and none of that. I'm tired of paying bills. I'm tired of this. I'm tired of that. He said, what I do, I got a P.O. box where I get my Social Security check. I get it every month. I buy me a 6-pack of beer, and I sit here on this corner, problem free. And I stay under $1 million structure. And I said, $1 million structure? I'm like, what is that? And I went and I thought, an overpass. Wow. We selling for overpass and cement. Not no roofs and floors, you know. Grief and losses.
So what I'm hearing is, so Mary used a word called as recovery deepens. So there's this huge spectrum. And so when somebody is at the end where Azzie's working, where their mental health is controlling their life, and when their life is totally out of control, they're definitely not in a space where we can talk about deeper concepts like grief and loss. And so, Steve, you notice as they come in when they're first detoxing, there's just so much that they're focusing on. But as they start to settle down session by session by session, you're noticing, okay, now we can start to talk about deeper things like, how are you feeling today? As he's trying to work with people who are like, what are you eating today? Where are you sleeping today? So when
Right,
those basic needs aren't met, it's hard to
right.
develop those higher concepts. So Steve, you work with people who are now stable, and they're just starting to drop down in their body where you can begin to say, let's talk about grief and loss. And Mary, you have people in the whole spectrum, but like you have said earlier, people deepen into their recovery. At first, there's the acute stuff you have to deal with, and then there's the ongoing stuff. And layer by layer by layer, they lose more things. So let's just talk a little bit more about, kind of Steve wanted us to talk about, as opposed to medicating people, why don't we educate them about the grief and the feelings? Let's talk more about that. So Steve, as you, like, what's the language you start to use with people to help them understand this is grief, not clinical depression?
Well, the thing is that like with Ozzy is that, you know, almost everybody today is dual. We have very few alcoholic or addicts, you know, and so it's hard to say don't medicate because most people come in already diagnosed. You know, the people I'm talking about are the ones that we do get from time to time that have been clinically diagnosed. Why do we have to diagnose them right away? You know, why do we want to diagnose them right away? Right. And then the ones that are diagnosed, now that they are stable on the meds, they're still going through grief and loss. So yes, the conversation is going to be, okay, now, you know, you're feeling this. Okay, what is different between depression as you normally feel it? What is your normal depression defiance, you know, or defining? What is your normal depression? And then what are you feeling now? You know, what's on top of what you normally feel? What's going on? And I get a lot of times it's worse, but it's different. And it's, you know, and they'll tell me things, and so then we go from there, right? Well, let's look at what's worse and different. You know, is it sadness? Is there a sadness involved where there was more of a darkness per se on the depression that you would normally feel? Because sadness comes with grief, right? And so if there's a depressed sadness, you know, and you're just not wanting to do something because, you know, I'm feeling sad and I'm you know, and I'm in that, why I don't want to go to that meeting because they're going to make me say I'm an alcoholic, and you know, and you know, I don't want to be labeled anymore, and I really don't want to be in treatment now, so I'm angry, you know, and you know, why am I doing all this stuff? I just don't ever feel right, you know. Well, to me, that's not necessarily clinical depression. That's kind of in that grief state. So when I hear him say that, I'm like, what are you feeling? Because do you have any idea what grief and loss is? Because I'm kind of feeling you're in a loss state right now. And do you understand the 5 stages of grief and loss? And can you tell me kind of what you're feeling? You know, And we got it. That's kind of what would be the language of some of the conversations I've had with my clients, because they can come into the office pretty ticked off about something. And I'm like, so what's going on? Oh, that guy across the room was looking at me funny. Okay, so are you sure this is a true statement? What are you really feeling? I'm just having a bad day. So what does a bad day mean? What does that look like? Could it be? That could be some grief and loss part stuff there going on. And we'll talk about it. And sometimes I'll get, huh, I never thought about it like that. Let me look at it. I'll give them some paperwork on grief and loss. I'll give them a worksheet. I got work handouts. I'll say, check this out. Do this for me, bring it to me next time, or drop it off to me tomorrow. What do you think? That kind of thing.
That's awesome. So, Mary, how do you weave in the language of grief? I mean, there's so much in recovery and relapse prevention. There's already so much, but how and when do you help them notice, that sounds like grief?
Yeah, it's a really good question, and I love all of what we're talking about. I would say, Barbara, for me, to maybe it's, I've been a social worker for a long time in the field with lots of different folks who are really suffering. I want to just clarify that addiction is an equal opportunity disease. Okay. So whether we are working with those, I work with, many of us work in and around the Bay Area, the hub, the Silicon Valley, those who have tremendous resources and those who have none. Addiction is an equal opportunity disease. And we believe in the field that it is a medical, progressive, chronic disease that is also fatal. People die. So whether it's Azzie, where you are now, Azzie, or Steve in the level socioeconomically of clients that come in, me who works kind of across the boards, but now I have a practice where people pay money. They have to pay, they have to have the money, or they have to have insurance, right? Private insurance. But I've done all of it. That is highlightable because when I'm working with people and I'm hearing us all talk about this, sometimes the language includes speaking directly about grief and loss. Absolutely. Where we might land, as Steve was saying, hey, that sounds like grief. Is this what's happening here? Is this a grieving moment you're having? Or I might use the word if they can't access the feeling, right? If it's hard, and we certainly know people get jammed up with feelings. We all do as human beings. So I might say, oh, this sounds like grief. Or I might put my hand to my chest or to my heart, right? Or put my hands together just in solidarity of, I don't have a word for what you might be feeling, yet I can show you through my body language that I got you. I feel you. I also will work very slowly with people. So I may say something like, gosh, this really sounds like sorrow and maybe some melancholy. I'll use some different words that hover around grief. And I'll say, please correct that if it's not accurate for you. I want to leave the door open, as we were hearing Azzie say, for people to bring whatever their experience is, even if I haven't had it or I don't agree with it. Or I think, how come they're not further down the road with their process of getting off drugs or of stabilizing in sobriety with abstinence for a long period of time? I may have my own feelings about that. So I will often say things, and my clients hear me say this a lot. I'm just going to put it out there. May not be spot on for you. That's okay. It creates more conversation for people to then start talking because at least they know I'm listening and I'm engaged and I'm interested and I care about them, right? Sometimes I will say things like, this is really, really difficult. I don't have the silver bullet answer. I don't have the magic wand. or I'll say, this is painful, what's happening right now. That can be symbolic of grief showing up, coming out, or the loss. They're getting more kind of clarity on, oh my gosh, the depths of loss that I'm in. What has left me? Or I've left myself. Right? I'm not even here. I'm a shell of myself, right? So I'll speak in that way with people. I want to say one thing about getting in too quickly to talk about grief and loss, like kind of actively talk about it. I think what Steve was saying about the handouts is awesome because it's within the educational framework and it has less threat for people. If I can read something and I can learn something up here, oh, I don't have to go back down here to the heart so much. That's okay. I can maybe do that. It can often feel safer for people to get educated versus to talk about feelings. Right? Feelings is tricky territory and hard. So for anyone out there who's watching and talking and listening to us, we get it. We get this is really difficult work and also simple work if we just go methodically and measured. So educating people can be enormous, and I will sometimes do the same thing. I'll say, hey, here's a handout. See what you think about it. And then I don't have skin in the game in that way. I just go, I'm just giving you resource. I can provide that. You don't have it. Let me offer it. So I'll do things like that. But I will say the slow pace that I go when I work with clients, whether it be a family or a couple or an individual, I pay attention to where they are in their addiction journey. Because if they are still highly activated and actively addicted or newly sober, like they just went to detox, but they don't want to go to the treatment program, so they're going to come see me, the therapist in the community. That's okay. I won't speak as actively like I'm doing here or with clients who have much more longevity of sobriety because they have what we call recovery capital. They have the bricks already built. They know how to stay sober for another day. They know where that next paycheck's going to come from so they can put food on the table. Yep. They know they've got a roof over their head tonight. They know they've started some communication with their kids or with their partner or with their former boss. So they have more capacity to actually talk about the deeper topics like grief and loss. And that also goes for grief and loss and trauma and PTSD. And not everybody does this in the field, but I like to wait because I think one of the leading causes of relapse or returning to use, I think we use now, is the lack of sober capital that people have. They're not ready to go to these deeper places. So we pay close attention in the field. Let's take notice of this because we're going to only push you and then we're going to push you a little bit more, but we're not going to throw you against the wall and then you're going to relapse because all these memories are coming up. You're having the nightmares that I can't manage these. I'm thinking about drinking a lot more. I'm thinking about going out there and going to the watching porn, going to the sex clubs. It could be really anything, right? We go slow. So grief and loss very much in the room, on the scene, and we are measured with it as we do it.
Yeah, that's the timing part is tricky. And
Yeah.
so I'm just thinking about in Azzie's world, their life is one big loss. They've lost everything. And so grief is practically this giant elephant in the room. And yet they're not even hardly ready to talk about it because you're just trying to get them stable enough to sleep in a shelter.
Right.
So I can't even imagine what that's like to the thing that's happening the very most is not within their capacity to discuss.
It's like speaking foreign language to them. You speak in English, but there's foreign language to them. You don't know what happened to me. You wasn't there. How can you place your thoughts or your decisions or your emotions on a feeling that you never dealt with? You wasn't there with me when I dealt with this, but I'm here with you right now. And I can hear it. Not only can you hear it, you can feel it. Because some people, you could feel that coming up off. I'm like, whoa, what is that? And if you're not strong enough yourself, that could come and implement into you too, though. You have to watch that. But at the same time, I think you just have to, it's a lot of compassion and empathy shown on a daily basis, and I'm talking hourly. And you might have just seen somebody 10 minutes ago, and next 10 minutes later, I'm gonna kill this so and so. Hey, we were just talking about going to get some coffee. Well, wait a minute. Cream, sugar, come on. Cafe, donut, let's go. Get them off. Change, But not only that, I also had them thinking about, well, why is this? Why is you like this? What is really going on? And sometimes when you get that relationship and able to cross that with the language that's not terrifying to them, that's a blessing right there, because now you got somebody at that stage where they might be willing just to open. And the only thing you want to do just to talk about it. I'm not a therapist or none of that, but I just want you to talk. Because I learned also as well, being in a recovery, talking was the number one thing. And I wouldn't talk, you could ask Barbara, I would cry. I wouldn't even talk, I just start crying. What you crying about? I don't know. What's going on? I don't know. Why are you crying? A man can't cry. What's going on? And she'll let me sit there and cry. But at the same time, in my mind, I'm going, damn, it is so much. Yeah. How can you, what layers to take off? And then, like I say, in the crowd I work with, I love it because they still teach it. I'm still learning about addiction. I'm still learning about grief and losses. I'm still learning how it's attached. How you can get so attached that it becomes a jacket. You got a jacket on that you don't even know you've been wearing. It's a hoodie, it's thick, but it keeps. And the thing is, too, we have to watch our judgment because that's how they feel. And I can't cross that. I want you to talk about really how you feel, but I'm not going to cross no line or nothing to harm our boundaries, because it might be that moment that day, Azzie, I'm ready to talk. Let's go. I'm shutting up. Let it out. Let it out. I don't care if you cry, cuss, let it out. Let it out to me. Because a lot of people have been holding a lot of stuff in. We talk about years, 20, 40 years. I remember I heard a lady say, my mama told me I would never be nothing. And I was at 9 years old. She was 58. I say, they got MP3 players, CD players now. You could put 100,000 songs on this little USB thing now. She say, what? I said, you don't have to listen to that song no more. You can change the music. You can change. You hear that, Pop? This is true, because they've been caught up so much in themselves that they don't believe they have power.
Right.
Until it's somebody like us who truly, that they feel, and they have to feel this, they trust us and they trust what we speaking. But at the same time, too, though, we got to make sure we trust and respect what we speaking to them, too, though, because they're just not know anybody.
That's a good segue. As you wanted us to talk about relationships in addiction and recovery, and I believe that addiction is a big time attachment disorder. And if people can't get their needs met as children, they're not able to attach to safe people, and somebody introduces them to a substance that takes all that away. It's like, there's my mommy, and they fall in love with it. They fall in love with the thing that the addiction does for them that mommy never knew how to do. And so even in the world where you are, as a constant turnover, constant chaos, it's your ability to pull them into a relationship with you and pull them into trusting you that enables them to make progress at all, do scary new things. And Steve, you have such a short time to build those relationships, but you have one of those very relational personas, so people just want to like you and build relationship with you, and you have creds and they can believe you. And then Mary, some of your clients you see longer, so you have a chance to build those deeper relationships and deeper trust and invite them into deeper stuff. But I think we would all agree that it's the relationship that enables people to come out of the dark and try new things. So let's talk about that. So Azzie, just talk briefly about relationship building in the midst of the chaos that you work in.
Oh, it's a if the wording is perceived right, it's a blessing. It could be a blessing, because even during the midst of a heated situation, for somehow after everything is boiled and done with, 2-3 days later, that person to come back. I remember what you said to me, and they was in a total mental state of mind. They was gone. You wouldn't understand. They would understand anything they got to deal with any kind of language, let alone with a feeling or an emotion. And then they come to you and go, you know what? You said this, that, and this that day, and it's like, wow. So that right there, is that me. I believe in everybody. When it comes to addiction, I believe everybody has a wall of addiction. But the thing is, we don't want them to tear that wall down. We want, me, myself personally, I built a relationship with each block, each brick on my wall. Negativity, bad decision-making, not accepting constructive criticism. I knew everything. I'm the shit. That was my wall. I learned that I'm going to take these bricks out this wall and build me a bridge. That way, I can go back and forth, or I can have somebody come over and see me, or we can both go together. You hear me? Because that wall is very important. And I think that's one thing about what we deal with. We're dealing with, even though they're human beings, but they got walls. We don't want them to tear that wall down because they'll be tearing them down. We want them to just get the brick out the wall and make a street or whatever. You can make a house if you want to, or you can build a street. Just just build that relationship so they can take pieces. And I don't care if you just take a rock out the wall, it's a chip every day. Chip at it. And build a relationship, solid foundation relationship.
Absolutely. That's awesome. So how about you, Steve? Just that building a relationship and teaching your clients to build relationships as sort of a foundation for a new way of being in the world that doesn't require an artificial mommy.
Well, the biggest, like what Ozzy says, is the biggest thing is gaining. There's a trust factor, and listening does a lot, and I heard him say having for them to talk or him to talk, on my end, a lot of times it's just to listen and allow them to just tell me what you want to tell me without judgment or fear, and take it in. And then sometimes just go, are you done? Do you need something from me? And if not, okay. I don't always have to give something back. And they really appreciate that a lot of times, just to be heard, just to be felt, needed, wanted, and appreciated, because as addicts or, people in addiction, we don't look at ourselves in the mirror well. I give everybody a poem. All my clients get a poem. It's called The Man in the Glass or The Woman in the Glass. And they get this poem, and it's about being able to look at yourself in the mirror and being okay with who you got to hang around with all day. And then the second assignment is to look in a mirror at yourself and say, I am worthy, I'm important, and I love you. And so they put the poem at the mirror. I have one in my bathroom. I use it. I've been using it for 23 years. I got it in treatment. And the thing is that I believe it works, and if you do it, and I have people that love, they come into my office and I give it to them and I say, it starts today. And they start to walk out and I go, I said it starts today. And they go, what? And I point, I have a mirror on my wall. So they have to go to the mirror and they have to say it as they walk out my office.
That's awesome.
And they love it. They love it, but it's just to be heard, to be acknowledged, to feel worthy. And, and I don't care You know, I work with a guy right now who's worth hundreds of millions, and he hates himself. You know, he doesn't know how to be a father. His kid, he doesn't only knows how to talk to his kids in business talk. We're working on how to talk as a parent. That's the goal now. His therapist and myself, that's what we're working with him as, so he can become a parent now that he's retired and not working and can't talk work to his kids.
Okay, Mary, so talk about that idea of how relationship building is foundational, and then segue into, I want you all to leave, like, if nobody listened to anything we said in this whole thing, and you had 1 minute of wisdom, what would that be? So Mary, talk about that idea of relationship, and then segue into your 1 minute takeaway for us.
Well, I'd like to say that addiction, we know, disrupts human relationships. And at the start of somebody using or compulsive behaviors, not only might there not have been someone in their corner, that's assuming that the person started and the churning of the addiction started as a young person, because it doesn't always, by the way. So it's not always the mommy, and mommy doesn't get it right. What I'd like to, so it's sometimes it can be that, but I want to make it broader in that what is happening and underway, not only the neurological addiction that gets ramped up, that's very real, but also the distance that a person has to themselves, like Steve was saying. I don't even know who this person is that I'm looking in the mirror. So by the time addiction is highly active, the relationship with oneself has been obliterated because the original self is no longer there, or maybe never was. Maybe there was not a soft landing into a family that could provide that. And not as a blaming of the family, but we get to understand that. And so addiction interrupts and disrupts all of relationshiping, including from your early ages, but then all the way through. And I think what we're talking about here that I believe deeply is to be able to sit with people in their pain and suffering and love them anyway. Even when we don't agree with how they act, even when we know that danger is around the corner when they walk out this door and they're going right to the danger, it's a real practice. It's something we get trained in, as we're talking about here. And it also becomes an art form that we can sit without judgment and love that person despite this. Because when we can hold that, and I would say for those of you who are thinking about getting a counselor or going to a treatment program or stepping into your local community center or going to a therapist, there are people out here like us who will be with you. We won't need to change you. We're not, maybe won't change you, but we're just going to be with you and give you the dignity of coming to who you are at this point in time. With recovery, that changes. And it's our work to take care of ourselves so that we don't bring back, and I think we were kind of saying this, we don't bring back the judgments, the expectations, the idea that you have to show up a certain way, maybe like everyone else in your life has done. So relationship to me is through modeling it. And when the studies are done, that is the number one thing that comes up for people around therapy and counseling and helping professions. I felt good to be with that person. I felt heard. I felt witnessed. We talk about those doctors that have good bedside manner and those that are more robotic and have poor bedside manner. That's not about what they learned in medical school, even though that's helpful and important. It's about how they can be with and connect with people. So the trust starts generating. And then they will say things. Azzie, I remember that. Remember what you said 2 days ago when we were in the melee of the fight, right? Or Steve, I remember that mirror now that I'm completing my program. I'm gonna buy my own mirror, right? Or Mary, people will say, I heard your voice. I heard what you were saying. I'm no miracle worker. I like to say I'm no better and no worse than the next guy. It's just we have cultivated through our skills of what we do, the ability to be quiet, to listen, to drop stuff in, to open up the trust, and then to love the people that we work with.
Yeah. So, what is your 1 minute of wisdom, the nugget of gold that would like to carry out of here?
I would like to, my nugget of gold is what I did as a young social worker when I worked with children, and I worked with children of addicted families, which was, you are not alone. There is help. You are not alone in this. Grief and loss begets more grief and loss if we keep it in the closet and keep it cloistered and keep it to ourselves. You deserve to talk about it and bring it to someone else, to bring it to people who can help, maybe, and including those who are not in your family or friend group. That's okay. We're out here to help, and you need not be alone.
Awesome. Thank you. So, Steve, what is the 1 minute of wisdom that you want people to carry out of this discussion about grieving and loss as it relates to addiction and recovery?
The first thing would be hate the addiction, not the person. And next thing would be is, when I used to teach family system strategies, is the families have everything that addicts have. They suffer grief and loss from losing the addict. They have triggers. They have that we give them. So there's things that they can relapse. So, there's help for the families, there's help for the addicted person, and but we like what Mary says, we meet them where they're at, and we take them where we can take them from there, but we don't judge and harm.
Mm-hmm.
Absolutely. That's awesome. So, Azzie, what would you like us to know about the most important thing you want people to carry out of this discussion from you?
Keep believing and continue to believe yourself, no matter the situation, no matter that. And find someone that you can confide in, But you also got to understand that you need to accept constructive criticism. They gonna do them a better self. And that's all we talk about is bettering oneself. And that's what we're here for, to better oneself. Somebody believe in us to better ourselves. That's what we're here for, to better oneself. And learn how to say no to self.
Yeah, absolutely. Well, thank you. I am always using this word, but I'm very honored to have been able to hang out with people who do this hard work and believe in it so much and are so passionate about what they do and are willing to take some time for free and offer some of that to the world. And so thank you so much for agreeing to participate and being here. And I hope I will see you all in person sometime soon.
Yeah.
Thanks,
Thank you.
Barbara.
Nice
guys.
meeting everybody.
Nice meeting you, Steve and Azzie.
You too.
Bye.
Good night, everybody.
You guys have a blessed one.
You too.
Bye.